Hi, my name is Lucy. I'm a medical clinical officer and a health educator with Mokazi Wellness here on YouTube and on Instagram. And in this video, I'll be telling you and I'll be teaching you on hormones, the female hormones, how they interact with our bodies, what they do to our bodies, how we can correct them if at all they have gone haywire. Woman, we majorly have three hormones. Not to say that you do not have any other, but these are the major hormones that you have in your body. Number one is a common one, and it's normally called the female power, and it's estrogen. Estrogen is that hormone that's responsible for us having the feminine factors, all the feminine attributes, the hips, the bums, development of breasts, and also it helps with the menstrual cycle, the flow of the cycle. As you develop into adulthood, the major contributing factor to the production of this hormone estrogen is the amount of body fat that you possess in your body. So when we clock around a weight of 40 kilograms, we will start to see these things coming in a woman. We'll start to see the girl getting some breasts, some hips coming, a bum coming. So that's the contributing factor. That's the good thing about the fat that's in the woman's body. And that is a reason why we are seeing young girls getting breasts when they're still young. It is responsible for the early puberty that we are witnessing right now in this generation. So the weight is a good factor to consider because weight is responsible for your production of estrogen. It's a good hormone because in its good balance, we find ourselves having clear skin. But on the flip side of it, when we have high amounts of estrogen, we find ourselves getting complications like hormonal acne. And hormonal acne is that acne that's witnessed on the jawlines or below the cheekbones. Most of the times it will progress to the other parts of the face, but the major thing to look out for is if your acne is beginning from around the jawline, there is an issue of body image where as women we start comparing ourselves to others with bigger bums, bigger hips, curved figures, tiny waists, and it's something that greatly affects our confidence. But I would want you to know that it is normal to be the shape that you are, because most of these attributes, all these features, it is the effect of the hormones that is causing us to appear the way that we appear. So if you find yourself with a smaller bum than another person, or smaller hips than another person, or even huger hips than another person, well, take heart and know that this is the hormone that's responsible for this. But also on the flip side, an excess of estrogen in your body, it causes disabilities in your menstrual periods, disabilities with your appearance. You find yourself with acne, and all this can be improved through nutrition. We would encourage you as a woman to embrace eating raw vegetables like carrots, like cucumber. Those help the body to release excess estrogen. And physical activities like exercising, running. As you sweat, the body excretes excess of these hormones. And that is why we see that sometimes after you've started exercising, your period may get better. You will stop getting cramps, or the cramps may reduce in the way that they've been paining, or even your skin will appear to be more vibrant and more beautiful. But while at the exercising, we encourage that you do not overdo it. Because when you over-exercise, the body will think of it as a stress factor, and it will release other hormones that will counteract your menstrual cycle, and will get issues of the menstrual cycle disappearing in some cases, or you struggling to conceive. We've seen this with most athletes. They will have some periods of struggling to conceive. It's because of the variations in this hormone. Secondly, we have another hormone called progesterone. Progesterone is produced by the ovary. When you are on your cycle, there is after ovulation, that thing that the egg comes from starts, can I call it like a shell? The shell where the egg comes from starts producing progesterone. So your body is wired to think and to monthly think that there's going to be a pregnancy. So when progesterone is produced, it will prepare your uterus to receive a child. And when it prepares the uterus to receive a child, this shell that has produced progesterone has a lifespan of only 14 days. So 14 to 10 days. So after those days, it will stop releasing progesterone and your body will know that there's no baby. So you will have your period. When you conceive and you get pregnant and it implants on your uterus, this hormone progesterone is responsible for keeping the pregnancy. So if you have low amounts of this hormone, those are cases where we see women quickly losing their pregnancies when they are still young. But there's an intervention available. If you have had like around 2 or 3 pregnancies lost in the first trimester, the first 3 months, please seek medical attention with your gynecologist or your healthcare provider, because there is an intervention where your body can be supported to keep your pregnancy, even when this particular hormone is low. Another thing that progesterone does, if you have not gotten pregnant, the decrease in the amounts of progesterone when the body signals that you have not gotten pregnant will lead to certain things like low mood, low energy levels. That's responsible for the PMS that we see, the premenstrual syndrome. You ever realize that towards your period, sometimes you're moody, sometimes you're highly irritable, you get headaches? This is the hormone that brings it. So to support your body and to support the body during this time, it is more of a psychological thing for you to know that it is the reduction in hormones. So you include activities that will help you to improve your mood. You include some self-care, you include some activities that will lift your spirit. Thirdly, we're going to look at a hormone called testosterone. And we know testosterone to be in men, but yes, even as a woman, you have levels of testosterone, though they are relatively low compared to the ones in men. So why do we have testosterone? We have testosterone for energy and also for the sex drive. So if you have low libido, you don't want to have sex, you find yourself in like those seasons where you feel like the energy level is really low, you feel you've woken up tired. So this is the hormone that's responsible for such feelings when they are low. But also in cases where we have high levels of testosterone, at times it may lead to infertility, but at times it may not. But there are things that we have as women that at times also cause us to have a negative body image. If you have some hair, some little beards, hairs on the nipples, as a woman, if you find yourself with some masculine features like having some hair on the jawline, some beards, having a mustache, most of the times they are really little hairs, but sometimes they are pronounced. Some little hairs on the chest, hairs around your nipple. Testosterone is the one responsible for that. And there's a myth that if a woman has a beard or if a woman has some hairs on her chest, she will not have children. That is a myth, because the amounts of testosterone is what contributes to the fertility factor. If they're in moderation, but they have influenced your body to get the hairs, you still have children, you still be fertile, you will have your cycle normally. But if you have these features and you are having problems with conception, you're having problems with if you're having problems with conception, then seek medical attention, because there are interventions to help you to regulate these hormones so that you can actually conceive. Testosterone is responsible, we have talked about the sex drive. So if your libido is really low, this is the hormone that most of the times is low. But there are things that could attribute or could cause it to go low. Things like stress, things like certain medications, chronic illnesses, things like diabetes, things like hypertension. They really affect the levels of these hormones. Thirdly, the other thing that affects all these hormones is menopause. And as women, we do not want to get old. None of us wants to be told we are old. We want to be forever young, forever 23. But menopause is a fact. Menopause is a reality. And there is a hormone replacement therapy that's available to help us manage these hormone variations once that time comes. But as we talk about menopause, there's such a thing as early menopause. Early menopause could come at about 40 or in your late 30s, when suddenly your periods disappear. This is something that can be managed by medical professions, so do not suffer when you get these things. You're still 30 and your periods have gone. Do not suffer in your kakon. Seek out medical attention. Solutions are available to help you. This is Mukazi Wellness. Follow us on Instagram and on YouTube and on TikTok. Bye.